Hi, I'm Dr. Shobha Badiger. I'm a senior consultant, pediatric hemato-oncology and bone marrow transplantation in Narayana Health, Bengaluru. Most children who come for some indication requiring bone marrow transplantation are likely to get cured with bone marrow transplantation. Thalassemia, the cure rates are very high. Leukemia, it's around 50%. So the rates differ depending on the disease. What is very important is coming on time for the treatment, especially in benign conditions like thalassemia, immunodeficiency disorders, aplastic anemia. The earlier you get transplanted, the better are the cure rates. Now, the next question is, what are the side effects? Side effects of bone marrow transplantation can be temporary or long term, serious or mild. I'll talk about the temporary side effects. The temporary side effects are vomiting, child may not eat well, appetite can come down, and they can have real severe hair fall, but these are all temporary. And they can also have mouth ulcers, what we call mucositis, but these problems are all temporary. And most of them, almost all of these will recover once they come out of the transplantation phase. The second is the long-term complications. Long-term complications, most of them today with the doses that we are using, the kind of medication we are using, it is extremely rare. But we need to know what they are. One is they can long-term, sometimes they can have cardiac complications, the heart-related complications. If they have received radiotherapy as a part of the conditioning regimen, then there can be some growth, height can be reduced, some hormonal problems can be there. But these are all not compulsory. Some children, depending on their genetic composition or their primary disease, they may be prone for second cancers, which can happen 20, 30 years later. But all these may not happen in all the children. What can happen in most of the children or almost all the children who undergo transplantation is infertility. They may not have their children of their own, and this is a very known complication in almost everyone. All the other complications that I said, long term, may or may not happen on every child. Now, what are the serious complications? Serious complications can happen during the transplantation, like they can acquire infection because it takes time for the stem cells to grow, multiply, and start functioning like normal immune cells, which is around 6 months, 3 months to 6 months. So during this time, the child can develop any infection. What is cough and cold to me, for the child who's undergoing transplantation on medications, can be serious pneumonia, sepsis, low BP, shock, and admission into intensive care unit. So the infection can be bacterial, viral, fungal, any of these. It can be mild or it can be severe depending on when this infection happens. So infection can be a serious problem if it happens during the time of transplantation. The other serious complications are drug-related complications, like if it can affect the kidneys, it can affect the brain, it can affect the heart. But again, these are not something that happens in everybody. Most of them sail through. They don't have much complications, and most of the times we are able to identify very early that this child is getting this drug-related complications, and we stop the drug and they reverse back to normalcy. The other third serious complication can be GVHD. GVHD means stem cells identifies the body as foreign and says, this is not my liver, this is not my skin, this is not my brain, this is not my intestine, and it starts fighting with these organs. Once it starts fighting these organs, they can have rashes if it has identified skin, if it is a skin GVHD. They can have severe diarrhea or blood in the motion if it is an intestinal GVHD. Rarely there can be lung GVHD, there can be brain GVHD. So GVHD we give medications to prevent this. Despite that, if GVHD happens, then we need to up the medications, increase the medications, which are nothing but immunosuppressions. And because they suppress immunity. By suppressing immunity, they stop the GVHD. So since we are suppressing the immunity, the other problem is infection. So most children who are on immunosuppression can have a high risk of infection. Doesn't mean that they get infected, but they have a high risk of infection. The other problems are not very common, but they can have certain transplant related complications like lung complications. They find it difficult to breathe, or what is called idiopathic pulmonary syndrome, what is called TATME. These are very rare but are known complications just because of transplantation. I would like to say stress, not scare you. That's why I would like to tell you that not all develop these complications. If there are 100 children who are going through bone marrow transplantation, then there may be around 10 children who will develop these serious complications. So the rate of complications varies anywhere between 10 to 20% depending on what type of transplantation it is. Now, when I say what type of transplantation, it can be transplantation with a matched donor, fully matched sibling donor, or fully matched related donor, which may be parent or aunt. Sometimes it can be matched unrelated donor, or it can be a mismatched donor or haplotransplantation. So depending on which transplantation it is, these complication rates vary. The safest is the matched sibling donor. The next safest is matched unrelated donor or haplotransplantation with depletion. And the next in line would be haplo without depletion or matched unrelated donor. Now, in this video, I would not want to go into detail about different transplantations. This, I think, would be enough for this video, wherein I spoke about different phases of transplantation and how, in general, irrespective of what the condition is, what happens during transplantation. I hope it helps you and give you some knowledge about this. Thank you.